Well, good morning, everybody. Welcome to Sangamon County Public Health Department. We're super pleased to have you here to make this announcement. My name is John Ridley. I'm the director for Sangamon County Health Department, and it is my pleasure this morning to introduce Dr. Samir Vora, our chief leading doctor of the state for IDPH. Dr. Vora was appointed August 1st of 2022 by Governor Pritzker in his position. He's a pediatrician with degrees in medicine, law, public policy, and is a cross-disciplinary leader in the state and national health policy formulation. Since becoming Illinois' top doctor, he's led the state through our COVID-19 pandemic and is now focusing his efforts to strengthen Illinois' public health infrastructure and build a unified vision for health in every corner of the state. So without further ado, Dr. Vora.
Well, thank you, Administrator Ridley, for your kind introduction and all of you for joining us today. I want to acknowledge a few kind of distinguished guests in the audience. We have leaders here from SIU School of Medicine, Springfield Memorial Hospital, Dr. Paul Sapetti from representing the Illinois State Medical Society, Springfield, as well as Springfield Clinic. We have HSHS St. John's Hospital, as well as our friends and leaders across government at the Department of Human Services, the Department of Healthcare and Family Services, and the Department of Children and Family Services. We're here today to recognize the vital work of public health professionals and healthcare providers as the state of Illinois works to reduce the spread of measles and other vaccine-preventable illnesses. Measles, as many of you know, is one of the most contagious viruses on Earth. It spreads through the air and infects 9 out of 10 unprotected people who are exposed. Unprotected people who are exposed. However, today I'm pleased to announce that the recent measles outbreak here in Illinois is officially over. Although we make this announcement knowing that the spread of measles continues to be a threat, it's a moment to reflect and acknowledge Illinois' public health efforts. Despite the soaring numbers of measles nationwide, the Southern Illinois outbreak was limited to 8 cases. Illinois had 2 additional isolated, unrelated cases in Cook County with no indication of further spread connected to those individuals. The end of the outbreak is especially noteworthy when we compare it to what is unfolding nationally. The Centers for Disease Control and Prevention reported this week that we have seen 1,288 cases of measles nationwide so far this year. That's the highest number in 30 years for an illness that was considered eradicated in the United States in the year 2000. Sadly, 3 of those cases nationally this year passed away, equaling the total number of measles-related fatalities in the last 24 years combined. In Illinois, we're relieved to tell a much different story. Through the leadership of Governor Pritzker and his deliberate focus on preparing for future and current public health crises, IDPH, along with our partners in public health, healthcare, and across state government, engaged in the necessary and effective advanced planning, nimble action, and robust response to limit a potentially harrowing situation to fewer than a dozen cases and no serious illnesses. The story of this success predates this year and is one where the Department of Public Health stands and is vigilant. But last year in Chicago and northeastern Illinois, we saw a rise in measles cases. And even though those cases were linked to a shelter with people in close proximity to each other, the swift action of our health professionals across multiple agencies allowed us to slow that disease's spread. The action of public health partners throughout the outbreak last year ended in just 2 months. So last year's outbreak focused our public health leaders to watch intently as measles cases began to climb at alarming numbers in other states. So when our first Illinois case was diagnosed in April, we took immediate action along with our partners, including local public health departments, hospitals, clinics, and other health care organizations. Our response was comprehensive and multifaceted. We worked to support our local health department partners who are on the front lines of the developing outbreak in Southern Illinois. Now, public health is enhanced by the power of partnership. And through the outstanding work of Franklin Williamson Bi-County Health Department, the Jackson County Health Department, and other community partners, patients with confirmed cases of measles were quarantined, while those close to them were monitored and, when necessary, given preventive immunizations. You will hear shortly about the work of these local health departments, their life-saving work which contained the spread and prevented measles from getting out of control in their communities. Public health interventions, however, go beyond just reacting to a crisis. Public health, at its core, is focused on prevention. We recognize that immunization is without a doubt the most effective tool to prevent the spread of measles. That is why we worked with our local partners on vaccine clinics, outreach clinics across Southern Illinois. IDPH activated mobile vaccinations to assist with immunization efforts across the state, procuring emergency services from Simpar, a mobile vaccine provider, to work with local health departments, schools, and other community providers to provide these mobile vaccine clinics. We also implemented communication strategies to advise and guide the public on steps that they could take to protect themselves. We targeted measles communication efforts in zip codes with low measles rates. We provided our public health professionals and our healthcare providers with a new measles toolkit. And we issued multiple health advisories. And we partnered with our other state agencies. We sent 2,000 school administrators and school nurses statewide messages on the potential for measles exposure and advised them to take action. We also used our modern technology to create a measles school outbreak prediction dashboard to help local school officials determine risk factors and evaluate what additional steps might be necessary. Now, this involved state agencies, as I mentioned, regional offices of education, school districts, early childhood organizations, the medical communities, local government, private organizations, all working together in that power of partnership to keep Illinoisans safe. We're proud to say that this comprehensive, thoughtful approach led to meaningful results for our residents. While many parts of the country experienced outbreaks, hospitalizations, and deaths, these actions allowed Illinois to stem the harmful spread of measles across our communities. Now, this is a testament to the public health infrastructure we have built here in Illinois with the support of Governor J.B. Pritzker and members of the Illinois General Assembly like Senator Doris Turner behind me today. And it's a testament to the people of Illinois who have understood what actions need to be taken to protect their own well-being and those of their families and friends. But let me be clear here today, this doesn't mean that we won't see another measles case in Illinois this year. Given the fact that measles cases are cropping up across the country, it could return here, possibly quickly. However, IDPH remains vigilant and ready to respond should measles resurface here in Illinois. For our Illinois residents, I say to you that this is also an important reminder that if people don't receive timely immunizations, then vaccine-preventable illnesses like measles can surface again. We're very fortunate to have safe, effective, and available vaccinations against measles and a host of other infectious diseases. As a pediatrician, I can't stress enough the importance of talking to your healthcare provider and making sure that you and your family are up to date on your immunizations. Now, we've long known that public health stands as an invisible shield, protecting the public from both chronic and infectious diseases. The story of public health is often a quiet one, though. We take the responsibility to protect your health today and prepare you for tomorrow with little fanfare or attention. However, it's also important to shine a light on public health efforts that keep Illinois communities safe. Our public health work against measles will continue today, tomorrow, and into the foreseeable future. IDPH remains prepared and ready, along with our community partners, as we continue to work to improve the health of Illinois' communities. And I want to thank you for your time and attention this morning. I'd like to now send it to one of our great experts in the Illinois Department of Public Health, our pediatric medicine medical advisor, Dr. Jennifer Suh, to talk about the leadership and response of our local public health partners. Dr. Suh?
Thank you, Director Vora. Good morning. I'm Dr. Jennifer Suh. I'm an internal medicine physician and pediatrician, and I'm the pediatric medicine medical advisor at IDPH. We have just heard about the end of the Southern Illinois measles outbreak and how our state has been able to limit the number of measles cases. And again, this is because we were prepared and ready to respond. When measles cases in the U.S. began to rapidly rise at the beginning of this year, even before our first case here in Illinois, IDPH increased communications with our local health departments and escalated outreach to those counties that had lower school measles vaccination rates. This included strategizing in collaboration with our state agency partners in education and early childhood on increasing measles vaccination rates in our Illinois children, including planning for mobile vaccination events through the local health departments and our mobile vaccine provider, Simpar. We also kept our healthcare partners updated on the measles situation and ensured they had guidance on not only how to respond to a patient who may have measles, but also on promoting and administering vaccinations. And Illinoisans responded. Already in March, we began to see a rise in the number of Illinois residents getting the measles vaccine, with our state immunization registry showing over 9,000 more individuals having received a measles vaccine in March as compared to February. So, when the first measles cases in Illinois were identified at the end of April, IDPH and our local health departments were ready. Our IDPH communicable disease section worked closely with the local health departments who ensured rapid isolation and close communication with infected individuals. As you heard, they also ensured quarantine and monitoring of known exposed individuals, assessed each of their immunity statuses, and provided vaccinations as needed. Importantly, the local health departments worked to ensure their broader communities were informed and got vaccinated. And our IDPH immunization section ensured ample vaccine supply was sent to those counties. As examples of the tireless work of the local health departments in this response, the Franklin, Williamson, Bi-County, and Jackson County health departments traveled from business to business in the affected communities to offer vaccinations. Jackson County Health Department also held mobile vaccination events in parking lots of community grocery stores in partnership with one of our IDPH Wellness on Wheels vans operated by SIH. They developed relationships with trusted community members who supported their efforts. They increased communications to residents through letters and social media posts and sent guidance to schools and healthcare providers. And the impact of these efforts is shown in the data. Franklin, Williamson, and Jackson counties saw more than twice as many individuals getting vaccinated each month in April and May as compared to the start of the year in January. And the entire state of Illinois saw a nearly 50% increase in the number of individuals getting the measles vaccine in May as compared to February, including individuals of all ages across the lifespan. But it is also important to highlight that Franklin, Williamson, and Jackson counties were able to limit the spread of measles because of their already existing strong vaccination rates. These counties all had over 96% measles vaccination rates in their schools, meaning their communities are highly protected against measles. So, while the Southern Illinois outbreak has ended, as Director Vora noted, our work does not stop here. We need to maintain this momentum to ensure high vaccination rates, especially as we prepare for a new school year. It's still summer, but now is the time to ensure children are up to date on their well child checks and all of their immunizations. As a reminder, children should get 2 doses of the measles or MMR vaccine, the first dose routinely at age 12 to 15 months, and the second dose at age 4 to 6 years. And 2 doses of the MMR vaccine are required prior to kindergarten entry. In addition, all of our state's cases this year have been in adults, so adults should also ensure they are vaccinated and immune. Because here in our state, we have just seen real-world proof of the importance and efficacy of vaccination in protecting Illinois residents and communities from the spread of disease. Thank you, and it is my pleasure to now turn it over to Dr. Vidya Sundaresan.
Thank you, Dr. Sir. Good morning. I'm Vidya Sundaresan. I'm an infectious diseases physician. I also have training in epidemiology along with infectious diseases and help advise on communicable diseases to Sangamon County Department of Public Health. In my day job, I see adults with severe and life-threatening infections, which is why it's personal to me to talk about the efficacy and safety of vaccines, as vaccine-preventable infections can be easily prevented. A safe and highly effective vaccine for measles has been available since 1967. Primarily administered as MMR vaccine, it protects against measles, mumps, and rubella. There's ample, high-quality scientific evidence that consistently shows that 1 dose of MMR vaccine offers 93 to 95% protection against measles, and with 2 doses, the protection for vaccinated individuals exceeds 97%. As is seen in many infectious diseases and communicable diseases, communities can benefit from herd immunity. For measles, 95% of the community is vaccinated or immune to measles. Outbreaks can then be prevented. Whenever this number drops below the threshold, our communities are at increased risk of acquiring and transmitting infections like measles. The CDC and WHO recommend 2-dose schedule for children and adults who do not have evidence of natural infection. MMR vaccine is a live attenuated or weakened virus vaccine with mild and transient adverse effects such as fever, injection site pain, and a mild rash. Serious adverse effects like anaphylaxis or allergy or bleeding are reported to be very rare. Breakthrough cases can occur very rarely in vaccinated individuals, and they tend to be very mild. Unvaccinated individuals, however, have a significantly higher risk, estimated at 71 to 83% higher, for developing severe complications like pneumonia, encephalitis, or swelling of the brain, hospitalizations, and death. Now, in the United States, measles has been declared to be eliminated since 2000. And this means that there are no endemic measles transmission for over a year in a single geographic area. Although outbreaks have continued to occur over years, they are sporadic in communities with low vaccination rates and controlled very quickly with effective public health measures. Elimination of measles was possible with high vaccination rates. We now stand at 1,288 cases nationally. 92% of that occurred in unvaccinated individuals. 11% hospitalization of these numbers, and 3 deaths from measles. And we also have a high risk of losing the elimination status. Vaccines save lives. Effective immunization programs have saved 154 million lives in the past 50 years, according to WHO. Vaccinology, science, and research has advanced dramatically over the last 2 centuries and continues to evolve. That is why it's critical that our policies and guidelines for pediatric as well as adult immunization practices are up to date, evidence-based, data-driven, and transparent. I'd like to thank Dr. Vora and the IDPH teams for their exceptional leadership during these difficult times, and I'll turn it back to Dr. Vora.
Thank you, Dr. Sundaresan. Now we want to take a moment to tell and have Mr. Yule James come to the podium to tell his own personal story about the challenges that measles can provide. Mr. James it had recent knee surgery, and we thank him for coming and telling all of you his very meaningful story. Mr. James.
Hi, thank you, Director, for allowing me to come and tell my story today. My dad was the United States Navy for his whole 20 years, which would be my whole childhood. And in 1964, we were living on the East Coast, and he got restationed to the West Coast. So we had to drive all the way across country. And this was back in 1964. The vaccine for the measles just came out in 63, I believe. And so it was relatively new. And the doctors on the East Coast said, oh, you need to get your kids vaccinated. And the move and the packing of the boxes and the figuring out the route, because we drove by car across the United States, took precedence over us getting vaccinated. So we drove across the United States, and I remember a couple things like gas being a nickel in Texas. And I lost my wallet because I left it in the bureau of the hotel, which is, I never do that anymore. So anyway, so we finally got to San Diego, my dad's new duty station, and within like a month or so, I came down with measles. And back then it was like, it's just measles. You know, all the kids get measles. Who cares? You know, not a big deal. Until at night I would get up and start raving and running around the house, yelling at pictures. And I remember very clearly that visually the pictures' heads would go in and out, you know, everything would leave wacko. And so Dad said, well, I think it's time to take the young man to the hospital. So we went to the Balboa Hospital and ended up in a coma for 3 days. And my parents were kicking themselves because they had the opportunity to get me vaccinated on the East Coast before this whole trip. And they're like, he could die. You know, that 1 in 1,000, I was that guy, 1 in 1,000. I could die. But I didn't, obviously. I'm still here. So I arose from my coma, and I had lots of probes in my head and making sure I was okay. Mom and Dad said my attitude did change, and that I was more sedate. I was a devil child as a baby. And so that's not to encourage you to get measles by any means, because it goes, I understand from Connie Austin, my wife, that it goes in the reverse too. You can get to be an evil person. So it depends on who you saw when you were in a coma for 3 days. So, but the big rule for me is that if it's FDA approved vaccine, I'm going to get it, you know, because it's going to save me and it'll protect other people. And that's real critical. So, thank you very much for letting me share my experiences. Director?
Well, thanks so much, Mr. James. And I think it's a place for us where when we often talk about these vaccine preventable illnesses, that we have a real gift when we're able to prevent them. And stories like Mr. James show that measles is something very serious, things that we've seen already this year. Next, I want to introduce our first Assistant Deputy Governor, Ryan Croak. As I mentioned, this work and the efforts of IDPH wouldn't be possible without the leadership of Governor Pritzker, but also the incredible team that he has in the governor's office that provides the resources, the leadership, so that our agencies across government, but especially in the Health and Human Services portfolio with Deputy Governor Ho and First Assistant Deputy Governor Ryan Croak, allow us to do our important jobs and help support us as we work to protect the health of Illinois' communities. So we would like to invite First Assistant Deputy Governor of Health and Human Services, Ryan Croak, to the podium.
Thank you so much, Dr. Vora. And big thanks to Mr. James for the courage that you displayed in sharing your own life story. I think it's quite meaningful indeed to hear from somebody who's experienced the real despair that families and individuals can face when they're confronting a measles diagnosis. I also want to just, because I think it's necessary, give one great shout out to Dr. Vora, his team, and to all of the healthcare heroes in this room, Dr. Suh, and everybody across the state and in this room for their extraordinary leadership in protecting the residents of Illinois against measles. So let's give the healthcare heroes of Illinois a big round of applause. Okay, I feel better now. Good morning. Okay, I'm here today on behalf of Governor Pritzker just to reinforce the important public health news that you've just heard. Thanks to the fast, coordinated response of the Illinois Department of Public Health, local health departments, and healthcare partners across the state, Illinois has had no new measles cases since May 22nd. This outcome is the result of smart, swift action that included, as you've heard, contact tracing, emergency quarantine guidance, targeted public messaging, vaccine outreach, including 14 mobile clinics deployed to the areas of Illinois that needed them most. But while the Illinois outbreak is over, a broader nationwide threat remains. Measles is making and has made a national comeback. As Dr. Vora mentioned, the CDC reports over 1,200 cases in calendar year 2025. That's the most the United States has seen in more than 30 years. 92% of those cases involve people who were unvaccinated or whose vaccination status is unknown. And let's be clear, this rise is not a fluke. It's the result of dangerous misinformation. Public figures like Robert F. Kennedy Jr. and President Trump, both of whom have flirted with anti-vaccine rhetoric, are undermining decades of public health progress in our country. Their backpedaling and pandering to anti-vaccine activists directly fuels fear and confusion. Misinformation spreads fast and puts real families at risk. In Illinois, we're committed to science, to facts, and to protecting our residents. Vaccines are safe. Vaccines work. And choosing not to vaccinate doesn't just endanger your child, it endangers every vulnerable person that you encounter. We urge, in the strongest possible terms, every family in Illinois to double check their vaccine records with their primary care providers and to do their part to keep our communities safe and strong. Thank you so much for your time today. It is now my great privilege to introduce a champion, not just for Central Illinois and for the communities that she serves, but for the public health mission of our state. There's very few greater friends to the public health and the public interest of the state of Illinois than our state senator, Doris Turner, who I am very pleased to welcome to the mic.
Good morning. As a former chief of the Center for Minority Health Services at the Illinois Department of Public Health and now championing public health legislation through the General Assembly, I understand how important today's press conference is. It highlights two things. It gives us an understanding of the strong collaborative work that the Department of Public Health does throughout our state with all of our collaborative partners and keeping the residents of our state safe. It has been said often that when public health is working and working well, you don't even know that we're there. You know, everything is working fine and you're going about your daily life and you don't even know public health is there. You don't even know what they do and how they're doing it. So congratulations, Dr. Vora. You're doing it extremely, extremely well with all of our collaborative partners. The second part of it is because when public health is working and working well, you don't know it's there. These events are important so that we get the message out that vaccinations are still important, and even things as simple as measles that we don't give a second thought to can, if you are not vaccinated and left untreated, can kill you. So we definitely want to make sure that we get that message out, and I think that we are relying on not only our public health partners throughout the state, but each of you in this room to talk to your friends, talk to your neighbors, talk to those other organizations and relationships that you have to talk about how important vaccinations are, because they definitely save lives and keep all of our communities safe. So thank you very much for all of the work that all of you do each and every day. It is extremely important, and I would welcome Dr. Vora back for answer any questions.
Thank you, State Senator Turner. We can smile and say IDPH's own State Senator Doris Turner. Happy to take any questions from the media.
So you mentioned that it was adults that got the virus, MMR, is that, I know that Tdap you have to re-up after a certain amount of time. What's the, do people need to get boosters if they've already gotten it as children?
So, and this is kind of maybe an important point of, well, when do you need an MMR vaccine? And so for our audience to know is that if these are the kind of four things to know that says that you have immunity from vaccines. One, you've gotten evidence of vaccines being given 2 shots into childhood. So that's one. You have lab evidence of immunity. So you take a blood test to say that you have measles immunity. Third, you were born before 1957. And that's a place where people born before that tend to, have kind of work through it. And then there's, other sort of elements of lab evidence that can be kind of put through to say that you've worked through and have immunity, even though you don't know for sure that you've gotten it, right? So let me go through those four again. Born before 1957, you've had documented 2-shot series in childhood. You have lab evidence of immunity that you have previously, gotten that work, and then sort of other elements of lab evidence that can show the vaccine was given. So those important elements, I'd say for adults, if you've gotten 1 dose into your adulthood, that covers. It should cover most people. There are special circumstances in which you would need a second dose into adulthood. Ultimately, for everybody, if you're unsure, have that conversation with your healthcare provider, right? We know that, and it's important as medical providers here, people have individual, unique circumstances. Have that conversation if you're not sure so that you can make sure that you're protected as well as possible.
Dr. Vora, Ryan already touched upon some of the struggles with the Trump administration, specifically RFK, highlighting much misinformation about vaccines of any type. How hard is it right now to reassure the public when that national voice is out there every single day and it's spread on podcasts, on whatever OAN thinks it is, things of that line?
Yeah, it is, and as First Assistant Deputy Governor Groke said, it is a difficult time because our messages in public health that for much of my career, based purely on the best evidence of the moment, you could trust national standards without question. There were gold standards. I've written in some letters to our colleagues of late the fact that I didn't have to worry about those things as a pediatrician goes to what State Senator Turner just said. you're in the shadows. They were doing the important work, and you could depend on it. Right now, it's a time where we are having to think very critically about the things that come from the federal government and the misinformation that is often spread. And that's why at IDPH, along and through the leadership of the governor, we are maintaining standards to bring our residents to Illinois the most credible, meaningful, evidence-based information to make the decisions that matter. We're talking to national specialty societies. We're working and having conversations with other states to ensure that the best evidence for our residents is the gold standard for IDPH and that people can depend on us to get the information that they need.
Dr. Vora, I was wondering if you could tell me a little bit about the measles exposure location list on IDPH's website. It's empty right now, but if there are going to be locations on that website, what does it look like? Is it a specific spot? Is it a region? How should people be reading that?
It's a good question, and I think one of the things that we want to sort of reassure people that is it's important for us to protect the privacy of our residents. And we maintain for all of our Illinois Department of Public Health practices that we're ensuring the protection along our HIPAA guidelines of the sensitive healthcare information that's there. But there are moments when there are particular locations that we know are of risk, and those are often places that ensuring those elements to protect people's privacy, that people can understand that this might be a location where if they've visited it in a particular period of time, they are at risk of exposure. And that risk of exposure means that they will be, monitored, talked to with their local health departments, and so ensuring that the measles virus doesn't spread further. That's the way that tool for our IDPH website should be looked at and viewed by our residents.
And about how long would one of those locations be an at-risk location if somebody with potentially measles stopped by?
Yeah. So as we mentioned, part of it is that it takes what we call these 2 incubation periods to officially declare an epidemic over. And so that's 21 days per incubation period. So you are theoretically at risk for exposure within that 21-day window. We often see signs before that, but that's why we say that, and as we make this announcement today, it takes about 21 days to monitor, and then we wait another 21 days to see that we don't have any other exposures. So it's typically that window, 21 days after that site, but to work with your local health department, your healthcare provider, and this is another sort of important mechanism because measles spreads so quickly in the air. When you are worried about this and going to see a healthcare provider, either in the emergency room or in your local clinic, to call ahead of time so they can set up that location to prevent any spread within a particular healthcare location.
Is it possible after that 40 days from start to finish there that it could happen again or could flare up again?
So part of that extra 21 days gives us that important buffer to make an announcement like this. I'd say for many of us who've practiced medicine or been involved in public health, there are always reasons where things like that, you never say 100% certainty of anything. But we make this kind of announcement today that at this point, right, the outbreak is over because we have great evidence that 2 incubation periods, that 42 days, allows us to make this with confidence. We are, as I said in my remarks, vigilant to, in case we have any more measles cases, but right now we have no outbreaks of worry or concern, but we're monitoring any kind of measles suspicious cases throughout the state as we speak.
What are some of the tactics you use to convince people who are on the fence over getting the MMR vaccine, either for themselves or for their children?
It is, I think, a little bit of a difficult time, right, where we're trying to have and prevent misinformation. But I think as you heard from Mr. James, we're very lucky to have vaccines that help and save lives. And we often speak in the public health community that vaccines are one of the greatest public health achievements ever. We don't worry about things with scary names like pertussis or, things that really have caused huge challenges, right? We don't even bring up polio as something that we're so fortunate in 2025 not to think about. And even as a provider, being able to provide that knowledge of the history of vaccines was every single kind of important moment as a general pediatrician that I try to put into my patients. But we know that it's often not something that people are ready to accept right away. And that's why it takes persistent, recurring messages. It takes the importance of building trust. As a general pediatrician, when you'd give your advice to young parents and they're like, oh, this guy kind of knows what he's talking about. It allows for the next opportunity to really kind of build that trust. And we're doing that in different ways. As many of you have seen our IDPH social media, using latest technology. But trust takes time, and to continue to build and grow it. That's why some of the messages that are coming from the federal government, where we're taking established work that have prevented these illnesses and we're putting that back into question, that's a challenge. And it's important for us. Science always is a process in which we have to think critically to make sure that we're doing what's best for our patients. And we're doing that at IDPH to make sure that we're not just thinking, in one box. We're being open to critical doubt, but elevating what should be elevated, that vaccines save lives. And we are very fortunate in the United States not to struggle with so many vaccine-preventable illnesses like many generations before us had to.
Time for one or two more questions, please.
Dr. Vora, I think you mentioned some new efforts, including the dashboard. Can you please specify which efforts were new with this outbreak, and what we learned from it?
I think one of the things that is a recurring lesson from the COVID-19 outbreak is simply like we need real-time data to help inform our decision-making process. Mm-hmm. And how we work with our partners, and the Illinois State Board of Education has been an incredible partner during this to get school-level data so that we can better understand what's at risk. And we know that there are incredible predictive models that are out there that allow us to really tell when risk is great and when risk is smaller. And so for those that haven't gone on the measles school district dashboard, I know when we introduced that for our incredible epidemiologists at IDPH, I immediately clicked on the school where my two young girls go to, and then clicked on my old high school and junior high as well. Luckily, we were all above 97% and no risk, but I think that puts those things into greater context. When you have to worry, why you have to worry, and sort of build that kind of community attention. I think the other thing that we've been working on is how do we make our messaging and our partnerships that much stronger, right? I spoke a little bit about the power of partnership, and we have incredible local public health leaders, as Dr. Suh went into detail about, but also incredible state agency partners, the healthcare leaders that are in this room. Public health is a team sport. You can't do it by itself. And the messaging that we go, and we are thankful that you're here listening to a government bureaucrat talk about this kind of stuff. It's even more important when we're engaging in fun, new ways. Our social media managers, our comms team that we have here, we've looked really into where we can find both areas to market and sell this work, and to sort of talk about it in new and ways that are more personal and meaningful, as opposed to at times where even my patients would be, give me a look and know that I went into doctor talk, and I need to sort of talk about these things as well as our residents in more meaningful, personal ways.
Last question, please. Dr. Berg, off-topic question about Mattoon right now. I know a lot of people are talking about their water there. Our most recent update, there's no timeline for when the water issue will be resolved for residents there. What can you tell the general public that are really struggling right now, too?
We're still, I think, watching that information really quickly. I know that our Office of Preparedness and Response at IDPH is working with the Illinois Emergency Management Agency to understand what those community needs are and work to provide state supports if needed.
Real quick, can I get the spelling of everyone's name if possible?
Yeah, we can get that through Jim Leach in our IDPH office. Thank you very much. Appreciate it.
Thank you.